At the media sensitization workshop held by the NHM Meghalaya, the Principal Secretary, Health and Family Welfare Government of Meghalaya, SAMPATH KUMAR, informed media persons that vaccination against the COVID-19 virus would be rolled out in phases. He also made mention of the fact that the vaccine is affordable and would be made available to the residents of the state.
Then actually we started bringing that awareness among the people about the need for the immunization, need for the vaccination. So today actually we are one of the top performers in the country in terms of the full immunization coverage of the children below 1 year. So what I would like to say is that it is so important that awareness and the people's participation is very, very important. There are two ways to look at it. One is that how actually we are providing the supply, whether vaccination is accessible, affordable. Yes, it is, vaccination is accessible and affordable, because there's one program actually Government of India is doing, is that it's actually taking care of the entire accessibility issue. Today, as I think you are aware, India has got a better capacity for vaccination, unlike other countries. So we have got that accessibility, and then affordability. Yes, Government of India is actually, providing this entire, especially for at least, the healthcare workers. We are starting with that. So that's one very important thing, is that the affordability. As people, even the last mile people, even the poorest of the poor, be able to get the vaccines. So, and the way the system is that we have a very good system. Especially India has got a very good system, in the sense we have this under this universal immunization program. We have this vaccination sites across the state. We have about 6,900 vaccination sites. 6,900 vaccination sites, and our people actually every month they do the vaccination. They know how to do the vaccination. So basically, we found last time, when we were reviewing why our immunization was low in the last year, when we were reviewing, some of the things have come up, basically people, if you actually go to the village every month, definitely your vaccination is really good, because people can actually come to the vaccination site, and it's easy for them, so they don't require to go out to the sub center or health center to get the vaccination. So that system is one thing that has helped us. Second thing is that we also actually have to remove some of the misconceptions, some refusals, some misconceptions, because people feel that okay, if my child is given the vaccination, my child got fever, so I'm worried about it. But actually, these are the things actually are common. For that, what we did, we gave this paracetamol solution, that's the kind of a thing, and giving awareness. Okay, if you get fever, do this. So that's it. Basically, it is essentially educating people about the entire nuances of the vaccination. That has helped us. Today 92% of 92% coverage. We are one of the, as I said, after Kerala and Telangana, we are the state with highest immunization coverage. So that's one very important thing that I would like to share, how these things are important, why this awareness and education is so important for the people to really understand.
Other attendees to the workshop include media persons, officers from the Health Department of Meghalaya, besides government officials of the state.